Greetings. I'm Dr. Mike Zachek of the Owensboro Health Pulmonary and Sleep Department. As you know, CPAP is an effective frontline therapy for obstructive sleep apnea patients. However, for a variety of reasons, some patients are unable to use CPAP successfully. These patients remain vulnerable to heart and brain health issues, accident risk, and diminished quality of life. An upper airway stimulation device is a treatment option intended to help some patients with obstructive sleep apnea who are unable to use CPAP. It's a small device inserted subcutaneously during an outpatient surgical procedure. Patients use the sleep remote to turn on therapy when they go to bed and turn it off when they wake up. The system collects therapy information, including objective adherence data, to help physicians optimize both comfort and effectiveness of the therapy for their patients. Upper airway stimulation received FDA approval in 2014, and to date, over 6,000 sleep apnea patients have been successfully treated with upper airway stimulation. This device is available in over 225 leading medical centers, and at this time, Owensboro Health is proud to offer this service to our patients. This animation shows how upper airway stimulation works. When the muscles and soft tissues of the throat relax and block the airway, the Inspire device delivers a mild stimulation to the hypoglossal nerve, which controls the muscles and movement of the tongue, stabilizing the upper airway and improving airflow. Since it's a motor nerve, the stimulation is delivered with very little sensation to the patient. The distal branches of the hypoglossal nerve control two important airway dilator muscles, the genioglossus and the geniohyoid. The targeted stimulation to this distal portion of the hypoglossal nerve activates these two muscles, which gently push the tongue forward to open the airway. These sedated endoscopy videos show airway patency in response to stimulation. On the left, stimulation is off, and you can see the airway obstruction at both the tongue base and the palate. On the right, mild stimulation is delivered during the inspiratory phase of the breathing cycle. The stimulation significantly increases airway patency at both the tongue base and the palate, creating a multi-level effect. For more information, please call 270-417-7515.